Okay, so today I want to give a demonstration of a female catheterisation. I've got Dr. Eloise here helping me out with the procedure. Eloise happens to be a female doctor, so that's in the ideal situation for a chaperone in this particular procedure. Guys, when you're actually considering a chaperone for any of your procedures, just ask yourself the question in the back of your head: what will that chaperone do in court? Are they going to support you, or are they going to support the patient should anything go wrong? Okay, so I've got Eloise here now. I've got my female bladder catheterisation kit ready to go. Before I do this procedure, I'll usually do a perianal toilet on the female and do a quick examination just to find out what position the patient needed to be in order to visualise a urethral opening. So with the urethral opening, that anatomy area on a female does change. It goes through proliferative changes with age and pregnancy and all the rest of it. So that's why it's particularly important to do that on a female beforehand. I've got my catheter pack here. There's different brands out there, but all the catheter brands will tell you the contents that's in it. I'm hoping that you get to see the catheter pack and how spoiled you are when you actually use these catheter packs as well, because it actually supplies everything with you. I've wiped down the trolley. I've given my hands a quick clean before I do my 3-minute hand wash, which I'm not going to do here. When I'm doing the procedure, I'm usually getting my sterile gloves underneath. That's what that sort of lower tray is for me, but I'm just going to put my gloves on up here. You can see that Eloise has got a pair of procedure gloves on to assist. I've asked Eloise to also get some sterile gloves as well too, because with this particular catheter trainer, I do need somebody with sterile gloves to reach underneath the fenestrated sheet to help me part the lips so that I can actually clean the area properly. All right, at this particular point, I'm happy with that. I've got my assistant here. I'm gonna go off and do my 3-minute hand wash. So after I do my 3-minute hand wash and I dry my hands, I'm now back and I'm gonna start the procedure. So there has been times where I've had 5 people helping me with the female bladder catheterisation. Somebody was holding up the abdomen that was quite pendulous, and people were helping sort of spread the sort of legs apart because the patient had poor mobility and dexterity, and it was a cast of thousands for the poor lady. Okay, so if you Mia, if you come in and just sort of have a look at the contents here, they've just got a whole bunch of goodies here. All right. They even give you the normal saline to clean the area with. So we use normal saline. Back in the day, I used to use a chlorhexidine cetramide mix. But since we've been using saline, I actually did suspect that maybe there'd be a rise in urinary tract infections, and there wasn't. It's still high in terms of hospital-acquired infections, but it didn't rise significantly in the health service that I'm associated with just by using normal saline. They also give you water for injection preloaded. It's water for injection. So it's not a crystalloid, it's not appropriate to put a crystalloid inside the balloon of the catheter. Eloise, would you mind just opening the catheter pack for me? Thanks. Okay, so she's opening and nice and still, and I'm able to grab everything, thank you. So when I'm doing this procedure, I would organise a dirty area away from the patient and everything else. In this particular case, I'm just putting it over there. But on the ward situation, I'll have a chair behind me with a blue sheet and I'll put everything there. So the way I've organised things now is I've got my clean area, I have my patient, and I have my dirty area here. Okay, they give you a fenestrated sheet. I just want to talk quickly about the fenestrated sheet. When you actually get this sheet, it's quite large. Step away from your sterile area. And there's 2 sides. There's a rough side and a smooth side. Thank you. We usually have the rough side up. It's hydrophilic and it will attract any fluid to go on there. Now, in the case of like a bladder infection, I would probably consider using the hydrophobic side, so the smooth side up, to get the fluid away from the area that I'm cleaning. It's really up to you, but it's certainly not something to worry too much about. All right, I've got my lubricant here as well, so I may as well get my lubricant ready. Okay, so now I consider this procedure to start now. So would you be able to put your sterile gloves on? And so while you're putting your sterile gloves on, I'd like you to reach underneath the fenestrated sheet and just part the area so I could give the area a good clean. So while she's putting her gloves on, I will clean the area. I'll just start. Okay, so best practice guidelines tell you that with anything that we're cleaning, we need to actually clean it 3 times. So I'm cleaning north to south. So I'm taking my neck scores. I don't want to take that plastic with me. And I'm cleaning that. So for all 3 cleans, I would probably get Eloise to be sort of parting the area for me. Okay, so now I can access the area. If you just reach in and then just part the labia minora and the labia majora for me. Okay, good. So I'll leave those here and then I'll go down. Now you'll notice that Eloise has got some sterile gloves on. If I accidentally touched her sterile gloves, it doesn't really sort of matter. All right. So Eloise, what I might do now is that, so Mia, if you can actually just show that I'm actually lubricating this catheter now. And again, just same with the male catheterization. Take the end, this is how I do it anyway. I take the end of the catheter, I bring the whole receptacle over, right? So now what I'll do is that, I'll get you to move now, thanks. And then I'll part the lips here and I can locate the area that I located earlier, grabbing the catheter on the end, and then I'll now thread it through. Again, if Eloise's hands were still there, it wouldn't be such a deal breaker if the catheter touched her hands because she's got some sterile gloves on. So Eloise, would you mind just grabbing the, yeah, thanks. And you can connect it whenever you're ready. So by now I'd be getting some urine in, and then I would, if you can just get this shot, Mia, I'm just gonna push this in probably about 1.5 inches further. But the urethral passage on a female is an average of about 3 to 4 centimeters. Eloise, would you mind inflating the balloon? Are you okay with that? Yeah. So the procedure's kind of over anyway. So what I'd be doing now is that I'd be taking this catheter dressing on the patient's leg. When you tear the fenestrated dressing off, just pick a corner because the corner's got a little bit of a weakness there, and then it's easier to tear off, okay? Really not that easy, but all right, thank you. All right, so we'll just cover our patient up now. All right, thanks, madam. And then I can just put this catheter dressing on. Obviously, this trainer doesn't have legs, but Mia, if you just wanted to come in, I just wanted to show people how to do the dressing as well. This is actually a really cool design, okay? It just sort of clicks on. I was going over the procedure earlier with one of the students, Jeff, and he actually said that it's kind of like a Velcro zip tie, and it is, and it's really cool. So, so thanks for watching. Just wanted to introduce you to some of the students in the class. Okay, I'll catch you next time.